again, and today I got another awesome webinar here. I've been geeking out for the last couple weeks here on blood sugar and how you must have your blood sugar regulated to a T. Now, if you're watching this and you're liking my content, give me a thumbs up, subscribe to my station, share this content, man, because there's too many people suffering that need this information. Now, at the end of this video, I'm going to give you a key clinical gem that you can apply to help your own blood sugar dysregulation. So let's get into this. So your blood sugar and your symptomatology. So let's kind of go over that. And what does that all look like? What does that mean? So do you have blood sugar dysregulation? So one of the things that we're talking about here is when we're talking about blood sugar dysregulation is we want to make sure that you don't have any insulin or sugar spikes, glucose or insulin spikes, because when this happens, this can cause global inflammation and cause problems in your body and you not heal correctly. So this would be, I would say, a low-hanging fruit, but you need to have a strategic plan to move forward to figure out, do you actually have hypoglycemia? So let's kind of go over this. Now, this is a very, very critical question right here. Is no fatigue or change in energy after you eat meals. So this is very critical. When you eat food, what should happen? There should be one thing that happens, and that's it. Your hunger pains go away, right? When you eat food, that's the only thing that we're looking for is your hunger pains go away. That would tell you that you have normal sugar and sugar regulation. Now, if you have something other than that, like what would that be? So here, when you have hypoglycemia, okay, not enough sugar, your sugar drops too low, you're going to have energy after you eat. All right, so this is going to indicate that you have some kind of blood sugar dysregulation. And then we have insulin resistance right here, which would be too much insulin, too much sugar. This would be pre-diabetic or diabetes. And this here is if you have fatigue after meals. So this is real critical right here. Is one, when you eat, you should have no change in energy at all. Now, if you do, that tells you right there out the chute that you have some kind of blood sugar dysregulation. It can be hypoglycemia, hyperglycemia, or it could be a mixed pattern. Okay, so if you have this, you're not going to get better the way you should. So we got to have some kind of strategy, some kind of technique on what needs to happen in order for you to get well. Now, this is normal glucose. You can spend some time looking at that. And this is hypoglycemia. One of the things with hypoglycemia is difficulty staying asleep. Now, what happens is when you're sleeping here, when you're in bed, what happens is your glucose starts to decrease, and then your body needs to increase your glucose levels. Now, when you have hypoglycemia, your blood sugar drops too low, and your body doesn't have the mechanisms to break down glucose, then you're going to wake up because norepinephrine and epinephrine, those hormones, those fight or flight hormones, start to kick up, and then you wake up. Okay, so this is a classic example of you having hypoglycemia. And then right here, when you have too much insulin resistance or too much glucose, you have a difficulty falling asleep, crash in after lunch, wake up not feeling rested. So you can look at that and see if you have any of these things. Now, let's go over what normal, healthy glucose patterns should look like. Let's go over that. So the green right here is normal. So you eat some food, your blood sugar goes up a little bit, and then it comes down, and then it normalizes like that. That's normal. Now, this is where we have a mixed pattern, hyper to hypo sugar levels. So you eat something here, the yellow, you go really high, and then you crash, right? And then you get shaky and jittery, and then your blood sugar is all over the place, okay? That's one level. Or you could have the red one, you eat some food, and then you go to hypoglycemia, and then it comes up. So these are the patterns that we need to figure out. And then we have the blue pattern, which is you eat something, but it spikes too high, and then you drop, not the hypoglycemia condition, but you're dropping. So what we really want to do here is we want to have you in this green, nice, symmetrical area. That's what we're looking for, is the green right in here, the green right in here, and then you come down. All right. Now, this is the general. This would be the general symptoms of dysglycemia in general, hyper, hypo, or mixed pattern. Okay, fatigue, insomnia, mood swing, anxiety, depression, hair thinning. Yes, ladies, hair thinning If you're not getting enough glucose to your hair follicles, you're going to get thinning hair. I have a whole bunch of other content on that as well. Infertility and impaired metabolism to lose weight or gain weight. So both, okay? So these are symptoms of too much sugar, too much insulin, fatigue after meals, impaired brain function after meals, like you can't think, you have brain fog, brain fatigue, sugar cravings after meals, chronic inflammation, frequent urination, and exercise problems. Now, this is hypoglycemia, fatigue between meals, okay, crashing around 3 to 4 p.m., sugar cravings, improved energy and function after meals. So again, this is critical. You should eat, and the only change that you should get is your hunger pain should go away. If you've something other than that, you have a dysglycemia pattern, which means you have too much, too low. It can be a variety of different things, okay? Bouts of mental fatigue and difficulty staying asleep. Now, this is the gem. Let me get me to a small little spot right here. So this clinically is the gem I'm going to show you right here. So they've done some studies. And you're going to see the glucose metabolism, right? This is blood glucose. So this is corn flakes. This is rice. These are meals now. Turkey dinner and then yogurt. So what they've done is they've had someone take corn flakes and then they monitored their glucose, 0, 30 minutes, 60 minutes, 90 minutes, and 120. And you can see how this went up, right? It spiked and then it came down. Now what they did in the blue here, they did glucose with 5 grams of fiber. Now look what happened to the glucose. It was more level. It didn't go up so much. So if you have some of these patterns, these hyper to hypoglycemic patterns, just by taking fiber can equalize this out. This is one method. This is one polytherapy approach. Now you may not be able to you may not be able to tolerate fiber, right? So you need to take this as you need a polytherapy strategic approach. But I wanted to cover this research study. Now this is rice. Rice is almost immediately turns to sugar. So you can see rice, boom, high glucose in the blood. Added 5 grams of fiber, and then you can see how that went down. So this is fiber with rice. Okay, we have turkey dinner right here, spiked, and then added 5 grams, went down. Here we have yogurt. So you can see what's happening just by 5 grams of fiber. This is with every meal now, just not once, but with every substantial meal. Now, what this actually did is the sugar normalized the pattern more like this, right? Okay, so that's the gem for today. Blood sugar dysregulation. This is a huge problem with many people. Again, if you like my video, give me a thumbs up, share it, subscribe. And just remember, folks, is where there's help, there's hope. Take care. Bye-bye.